Good morning, and welcome to this very special event from City and State, a one-on-one interview with Governor Kathy Hochul. I'm Zach Williams, Senior State Politics Reporter at City and State. Thanks again for joining us. Before we jump into the interview, I just want to thank our great sponsor, AARP, and our wonderful events team at City and State, of course, for making this event happen. We're aiming to cover a lot of ground today to learn more about the new governor's positions on housing, healthcare, COVID-19, criminal justice reforms, and more. But before we get to that, we're going to set the mood by inviting Beth Finkel, New York State Director at the AARP, for some pre-recorded remarks to set that mood.
AARP New York is so pleased to sponsor this important conversation with the governor. We want to thank City and State for hosting this event. Especially, we want to thank Governor Kathy Hochul for her time in addressing the key issues before us, and there are many. New Yorkers continue to struggle to pay rent and utility bills and other expenses because of the pandemic. The health and safety of New Yorkers, especially those in nursing homes, remain a major concern, and the skyrocketing price of prescription drugs, 3 times higher than what people pay in other nations. These problems and more pose an especially difficult challenge for New Yorkers 50 and older who need more prescription medication, have suffered a higher rate of pandemic job losses than younger New Yorkers, and of course make up virtually the entire population of nursing homes. We are pleased the governor recently signed 2 new laws to help the 50 plus. One strengthens the Secure Choice Savings Program, giving 2.5 million working New Yorkers an easy and effective way to save for their future. And the other expands the state's already robust paid family leave program to siblings. Governor Hochul also took action to help New Yorkers cope with overdue rent and utility bills so they could avoid power shutoffs, and to examine where we need to expand affordable high-speed internet. We are also so pleased that the governor, who stood with us in 2017 when New York became the first state to join the AARP World Health Organization network, Age-Friendly States and Communities. And then recently, she renewed an executive order to ensure that New York continues making our communities more livable for people of all ages. Well, there is much more that needs to be done. While AARP is pushing hard right now in Washington for meaningful policies to lower the cost of prescription drugs, New York can and should take action right now. We can end shady pay-for-delay deals where brand name drug makers pay generic manufacturers to keep affordable generic prescription drugs from reaching consumers much sooner. New York cannot continue to allow this unscrupulous business practice. We can explore a state program to import prescription drugs from Canada at much lower costs, or at least use international price referencing to drive down prices in New York. And we can expand eligibility for the Medicare Savings Program to help more middle-class seniors afford their medications and other healthcare costs. Family caregivers also need more support. 2.5 million family caregivers across New York contribute 2.4 billion hours of unpaid care, valued at over $31 billion every year, to ensure that our aging parents, spouses, and other loved ones are safe and looked after. And yes, that's billion with a B in both instances. And family caregivers spend an average of over $7,200 of their own money on caregiving to boot. We're fighting for a federal tax credit to help caregivers offset these expenses in Washington. But again, we can act here in New York. Legislation to create a state tax credit was introduced several years ago. And as the state's economy recovers, it's time to enact it now. While the state has taken big strides to increase funding for home and community-based services, waiting lists remain, and more and should be done. These services, such as home-delivered meals, assistance with transportation to medical appointments, and more, allow our loved ones to remain at home and avoid unwanted, costly, and mostly taxpayer-funded nursing home placements. We thank the governor for apologizing to the families of nursing home residents who died from COVID. That was an important step in addressing the workforce shortages and strengthening the long-term care ombudsman program to help keep an independent eye on nursing home conditions. That would also help. But we also need more affordable housing in the state. AARP New York supports legislation that would encourage so-called in-law apartments and regulate them so that we can avoid tragedies like what happened in the recent storm. There were 11 drownings in New York City of residents in illegal, unregulated basement apartments. And this would also, we need to expand options for older adults to be able to age in their community. And most importantly of all, finally, it is time to rethink how we approach aging and affirm that people 50 plus are valued, respected, and deserve to live in healthy, safe communities that meet their needs. It is time for New York to launch a comprehensive cross-sector blueprint for aging. So again, there's a lot to do. And we really look forward to hearing from Governor Kathy Hochul on her plans to address these and other issues. Thank you.
Excellent. Well, that really set the mood. And I could have sworn there was one more video from the AARP, but if I was mistaken, then we will jump right into the conversation. So I think Beth Finkel brought up something that's really been mentioned a lot lately, which is housing. It's too expensive and there's just not enough of it, whether you're in New York City, the suburbs, or even Buffalo or other upstate cities. One thing she mentioned was the so-called granny flats, AKA accessory dwelling units. There is legislation, as she mentioned, that would allow at least one accessory dwelling unit on zone for single family and multifamily use, but a provision in the bill, Governor, limits rent increases. What do you think about this legislative push and this so-called good cause provision specifically? And of course, thank you so much for joining us.
Well, first of all, thank you for hosting, and AARP, we've been standing together for so many years, working to really enrich the lives of older New Yorkers, 16% of our population, and to make sure that not just before the pandemic that they had what they needed, but particularly during the pandemic, we saw how really, truly affected they were, not just the nursing homes, but also the people that were trapped in their homes and didn't have connection with their families, and how they truly declined as a result of this. So we need to do more to just lift them back up and get to where they were even before the pandemic. And what she spoke about, and you're talking about the housing, and I think this is such an important issue. What I saw firsthand in the aftermath of Hurricane Ida, as I walked the streets of East Elmhurst and saw these basement dwelling units that were truly subhuman. No one should have ever lived in them because they did not have an easy way out. There was no exit for people. That's why they were literally trapped in their homes and drowned. That really shocked the conscience of so many people. And to realize that there are people relegated to living like that. And many people who've come here, immigrants, the culture is that your older parents and grandparents live with you, but the space does not lend itself to that. So we need to take a whole look at this. And I'm going to be putting together a task force of people to address this issue, because I know there's a lot of zoning issues. There's the people who need the income, but there's neighborhood concerns. I know all the pros and cons of this, but the reality is we are a better society if we can make accommodations for people to live with their own family members, keep them out of long care facilities if their health allows them to stay home, which I think is going to enrich their lives as well as the lives of the next generations who benefit from having these older family members living with them or adjacent on the property or in the basement or even in a unit that's built on the land. So Zach, it's a real problem, and not just those accessory dwelling units, which we're going to talk about legislatively, and I'm willing to see what all the legislators are willing to do. And again, I'll just take a chance to state my priorities here. One is to listen to the legislators. I know that's a little bit radical coming out of the governor's office, but I know they've studied this. These are their constituents. So I will first listen to them on what plans they want and talk to the leadership in the legislature about how we get that done. But overall, We need to keep building more affordable housing. I have been to more groundbreakings and ribbon cuttings for senior housing than anyone in the state, converting old abandoned schools into beautiful experiences. I remember seeing one senior citizen, they said, I went to first grade in this classroom and now it's where I live. So we can do that. We have the resources. We also know how to do wraparound services, so people can be getting meals or getting well visits right in the building that they're living in. And we also know that many of our public housing units across the state, or whether it's NYCHA, are occupied by senior citizens. And in far too many cases, those conditions are abhorrent. So we need to fix up the existing housing and continue to build more housing stock. So I'll be putting this together in a larger package and talking about this in my State of the State address.
Now, on good cause specifically, it's a controversial provision of this bill about accessory dwelling units, but there's also another bill that would basically limit rent increases statewide while also imposing some new limits on how landlords might evict a tenant. What is your position on that specifically?
I'm going to look at all those in the context of what we're doing with the pandemic. I mean, that really did affect the whole dynamics of the landlord-tenant relationship. A lot of people have not been able to pay their rent through this, and I was really proud on the first days of my administration. We were able to identify the barriers, why this money that was there to help people make the landlords whole, but also alleviate the stress on people who know that the month after month after month when they weren't employed, weren't able to make those payments. I got billions of dollars out within weeks. Very proud of that. And I'm going to continue making sure that all the federal money that's coming to us, and we can talk about what's going on in Washington, because I'm really hopeful that they can get the Build Back Better agenda accomplished, get it over the finish line, get that money out to the states, and I'll make sure it's there. But with respect to the specific bills you're talking about, Zach, I'm not going to prejudge them right now. I want to see what the legislature's priorities are, work with them, and I'll be having meetings with the leadership prior to the session starting.
Well, I'm going to have to push a little bit on 421A. A lot of people are wondering what your position is on this, a state law that gives, as I'm sure you know, developers a tax break in exchange for setting aside a certain percentage of units for below market rate tenants. It expires in June. Do you think it should be renewed in some form? And if so, as is, or with what type of changes?
I'm making modifications, but again, I'm not just pushing you off here, Zach. The timing is such that I want to be able to have the conversations with the Assembly leadership, the Senate leadership in a collaborative way, so there's a higher percentage of success in getting a shared vision accomplished. I do not want to see this go down to the final weeks of the session, become a political football. I believe that the developers who have been hit hard during this pandemic, a lot of our buildings in places like Manhattan are only 20 to 30% occupied. People are not coming back and they're not paying their rental units as well. So there's a whole dynamic here which was completely different than what we saw just a month before the pandemic hit. So we need to be cognizant of that change and recognize that it is in our best interest to continue populating existing buildings, but also encouraging developers to build affordable housing. They will not continue doing this if it's not worth their financial while. So I have to strike the right balance and make sure that we're meeting the needs, make sure that this housing is built, that there's plenty more affordable housing there is right now. That's why we have a housing crisis, places Long Island where I was yesterday, all the way through the 5 boroughs and on upward. I mean, people can't live in the neighborhood they're born in. I mean, that's tragic. We talk about the senior experience. It's a beautiful thing when grandparents can walk down the street and see their grandkids, but very likely their adult grandkids cannot afford to live on that same block. And that's something we have to change and inject more affordability. So it's increasing the supply. It's having certain restrictions on increases, but in a way that does not crush the industry, because I need the industry overall to be healthy. I need them to be strong, and I need to get people back downtown. And I don't know, I can't do this, but if I could magically ban Zoom and say it's over, despite the fact that we're able to communicate with people on this webinar, if people had to get back to their offices, I think people would feel this better sense of normalcy. But the first thing we have to do is get this pandemic wiped out, make sure that we're getting more people vaccinated, and that still remains a high priority. So I can see the end. We're just not quite there yet. But this all ties in together. I mean, there's a larger dynamic, a conversation that would not have been necessary if the pandemic hadn't brought the city of New York and the state to its knees for a time period. And now we're just trying to get back up and crawl before we can walk again.
So I have one more question about housing, and then we're going to move on to the very simple issue of healthcare, right? So right to counsel, in anywhere, if you're accused of a crime, you have a right to an attorney. Do you think that tenants across the state ought to be provided an attorney in housing court when they're fighting eviction?
I think that makes sense. It's something I'm willing to consider and look hard at. Again, there's costs associated with this. I believe in values, but I'm also a pragmatic Democrat, and I know I have to have the resources to accomplish these worthy goals. So this is a conversation I'm going to have with the leadership as well.
So pragmatism, I've heard that a lot on the next topic, prescription drugs. They're so expensive. It can be absolutely nuts. And we've heard a lot of elected leaders over the years talk about how we can lower prices. Your predecessor once touted plans to lower prices by establishing a commission on importation, which is also the focus of outstanding legislation before the state legislature. How do you plan to target affordability issues with prescriptions specifically?
Well, this is something I've lived with a long time. I was the one who was a primary caregiver for my Aunt Sophie before she passed away a few years ago. And I literally was the person who had to run to the drugstore and pick up her prescriptions for her. And I was shocked at what Aunt Sophie had to pay. And this was living in Lackawanna, where I was born, on the border with Canada, knowing that there are a lot of people in our community in Western New York who are making the trip across the Peace Bridge to buy the same drugs, regulated the same way, highest quality, same as what we have in the US, at a dramatically lower cost. That was just unconscionable. So I saw that effect on families. And Aunt Sophie used to worry about whether she could make those payments. And I was glad I could personally help her so many times. And this is just one example of thousands of families who are just seeing sticker shock all the time. When I was in Congress a decade ago, I was making the argument during my campaign to get there, which is when people say, how did I win in such a Republican district? I said, I talked to seniors. I walked into diners. I went to senior centers. We talked about the price of prescription drugs. We spoke about their anxiety about whether or not Medicare would be fundamentally altered under the Republicans as they had proposed at that time. So I've lived and breathed these issues, fought to get more controls. I never know why. And this was under George Bush's administration, that they didn't mandate negotiating prescription drug prices. You go to a VA hospital where the prices are negotiated, same drug, it's dramatically lower than what's available to our seniors. So what happened yesterday in Washington is a dramatic change. They sent a sweeping deal of reforms to ensure that for the first time ever, they could allow Medicare to negotiate drug prices. This is huge. We negotiate because you think about the volume. There is cost to be saved when they know that they can count on a certain volume of sales. Then you can say that we'll guarantee this volume of sales, you have to dramatically lower the price and you'll still end up in the same place. So that's what has to be happening. I'm real excited about what the Democrats are doing right now to address this, as well as I believe, and until this happens, if it doesn't happen, then we have to have the accessibility of being able to buy the drugs from abroad, without a doubt. And that is just unfair to our seniors and our families who are trying to count every single penny and ration out what they can afford for food, what they can afford for rent, what they can afford for their prescription drugs. And the prescription drugs should not be as high as they are.
Now, I'd imagine you're a little bit fortunate that everything going on in Washington is happening before the budget season begins. Is it fair to assume you're waiting to see what goes on in DC before really deciding your own plan for addressing prescription affordability?
Yeah, our timing is, you're absolutely right. It's perfect right now. I do believe that they'll get their programs in place. We'll know the dollar amounts coming to the state of New York, and people like Senator Schumer are watching these numbers like a hawk from his position as the majority leaders, which is enormously helpful to us. And Senator Gillibrand and I were just speaking about this a couple days ago when we got together, talking about these issues that are really the bread and butter issues that people are saying that Democrats don't talk about. They're wrong about that. This is what we are obsessed about, focusing on issues that the Republicans walked away from when they had the chance to make these changes. And now we are on the cusp of doing this. And we'll have for senior citizens a cap of what they'd have to pay out of pocket for their prescription drugs. You're a senior citizen on a fixed income, not sure about inflation, the price of all your foods going up. Are you going to be able to afford to invite the family over for Thanksgiving because the turkeys and the dressing and the potatoes have all gone up since last year? So if we can now say, we can handle the one part of your cost analysis as you're doing your budgeting at home, we can make sure there's not more than $2,000 a year you're going to have to spend on prescription drugs. That is going to allow seniors in the state of New York to have a huge sigh of relief, and they deserve it. They've been through so much with this pandemic.
Now let's assume that the federal government does nothing in the upcoming months on one specific practice by pharmaceutical companies, the so-called pay to play, which is where they pay to delay, where they actually, they actually offer patent settlements to generic drug companies in exchange for them not manufacturing generic drugs, which would of course lower the price. Assuming the federal government does nothing about this, do you intend to do action at the state level through the state budget process or in the legislative session?
We definitely know that's one of our options. I'm watching to see what's happening. Again, the timing is such that we'll see whether Washington's able to get this done, and I hope they are. But we have our own options at the state level, and this is what I've done, having served in every level of government, from town to county to federal to state. I know all the roles that the different governments can play, and when the federal government disappoints us, doesn't send the money we need for initiatives that we think are important, then we have the ability to step up and do it. But obviously the scale is going to be different. What the federal government can do is give us billions of dollars, as they did during the pandemic. The support we received for everything from the rent relief to small business relief to child care relief, all that really helped our economy and helped us find ourselves in a better financial position. But if they are not able to deliver anymore, then we do have to look at our own state coffers and figure out how to get this done and prioritize this. So yes, we're proud of many of the pharmaceutical companies in our state that have developed, for example, the life-saving vaccinations because of COVID. But we also want to make sure that everyone is playing by the same rules and they're not unseemly practices that have the effect of driving up the cost of prescription drugs.
Now, not all these genius questions are from me. A lot of them are submitted by our wonderful audience. And I think that by far the most submitted question was about the so-called medical aid in dying bill, which would allow terminally ill people to access prescriptions to end their life. And I'm really curious what your position is on this, especially considering how you've talked about your own faith in other contexts, vaccines, for example. What do you think about this bill?
Well, what's interesting about me is I have my own faith values, but I'm not going to impose them on other people. And that is why this is worth a larger conversation. I'm aware of the legislation that's out there to accomplish this. I don't believe it's gotten out of committee yet. So that says to me that the legislature is going to be having more of a conversation, a discussion about this that has to happen from them. I think this is another opportunity to talk about how I govern. Having worked my way up as an assembly intern, I understand the balance of responsibility, the balance of power, and it has been very dominated by the governor's office because the governor can do that. But it doesn't get us to changing people's perceptions of their government as a collaborative body that's out there, not fighting each other, but fighting for them. So this allows me the opportunity, again, this is on my agenda, to talk about to the leadership whether they think this has a likelihood of success. Is this something their members, who represents the same people I represent as our constituents, is this something that's a priority for them? Is this something they want to accomplish? So I assure you, we have a large list of issues to consider before the session starts. The conversations will be ongoing. And I think, as I'm hearing from a lot of people, they're feeling a breath of fresh air, a willingness to not be top down and demanding and saying, this is my way or the highway, but saying, I respect you as elected officials. You got here the same way I did, by the voters. People put their faith in us, and therefore we're going to work together.
Now, you've talked a lot about changing the culture in Albany, and certainly have done a few things to demonstrate that since you've come into office. But one big truth in Albany is that the budget process gives the governor, and New York governors are so much more powerful than their counterparts in most states. The budget process gives a New York governor huge leverage over lawmakers because of the 20-year-old state court decision, Silver v. Pataki. Would you support efforts to change this, kind of rebalance the balance of powers, if you will, through an amendment to the state constitution?
Well, after what happened with some of the ballot referendums a couple of days ago, I'm not always sure that that's the best route to go either. Something we consider, and I'll tell you what my approach.
I mean, to interrupt, Governor, just sorry, it's the only way this specific issue could be addressed.
But in terms of immediate impact, we know the long process. It has to pass the legislature not once but 2 consecutive sessions. It has to go. So you're talking about a 5-year issue, which I can talk about, but I'd rather talk about today. and talk about what I'm already doing in areas where I'm finding ways where it just doesn't make sense to me. I'm approaching government from a very common sense approach. Why does the state legislature and the governor have to weigh in on whether or not a school district in the city of New York has speed cameras in school zones? Tell me why that has to be relegated to an issue that becomes a political football at the end of a session in terms of extracting promises, concessions. I don't want to govern that way. I don't think that gets us where we need to go. So I'm going to be finding ways, and I've already asked my staff to do this, find areas, find regulations, find ways that we can start empowering the local governments, empowering the cities and the counties to do what they do best. They are the closest to the people. I know this, that's where I came from. So yes, there is enormous power in the governor's office right now. You can either abuse that power or you can use it to benefit the state. People will see in me, I'm going to use this to benefit the people of the state, and where it makes sense, return the power to the local governments so they feel that they're full partners instead of being subjected to the will of the governor, which I felt for many years when I spent time as a council member and as a county official. So a lifetime of experience in government has brought a different perspective of the role of state government, not having to be so heavy-handed. I'll accomplish the goals I need to get done, and I will do that with strength. But my first position is to reach out a hand in friendship and collaboration. But if I have to invoke the powers to get what I think is most important for the state, ultimately, I'll do that.
It sounds like you would not support an amendment to the state constitution on this point. Is that fair to say?
I'm fairly saying I'm not giving a straight answer on that. I will just tell you that I am conscious of the role I have now, that I can execute this. I will weigh the merits of doing this and look at it. Because of all the issues I've dealt with in the last 60 some days, from hurricanes to subway shutdowns to getting money out to people, it has not risen to the top of my priority list to analyze it, but I will be soliciting opinions on it and I'll give it some thought, but I'm just saying that's not my highest priority right now. I can execute almost, yeah, I can govern in a way that people will say that that's not necessary under a Hochul administration because they'll see a different approach. I don't need to take the steps to wait 5 years to get something done that I have the power to do right now, which is to share that power in a way that has not been done before.
But you would concede, though, that without this constitutional change, that would, whoever succeeds you as governor, whether it's in 1 year, 4 years, or 8 years, who knows, could have a very different attitude and nothing would have fundamentally changed, right?
I'm going to set out to prove that there's a whole new way of governing the state of New York. I believe that'll be rewarded at the polls, and so we'll be talking a long time in the future.
Gotcha. Now, one issue that's been really interesting to watch as you've become governor is, again, how you've kind of reached out to all sorts of different groups. And one thing that certainly has changed a lot over your course in your time in public office has been your positions on immigration-related issues. Now, I won't harp on the past, but I think you know what I'm talking about. I was really just curious in terms of healthcare. There is a proposal to expand access to the state Medicaid program to undocumented people. Is this something you would consider?
I'm going to be analyzing the price tag associated with that, first of all. And I will say that people have found me to be very open to supporting the immigrant community. For the first time ever, we were able to provide financial assistance to families that had their homes devastated during the pandemic. During the hurricane a few weeks ago, and put together a fund to allow them to get the resources they would have received from FEMA had they had documentation. That was extraordinary. People didn't see that would happen, but I said, these people were living here. I saw that they have nothing. I saw them on the ground trying to pick up little kids' sneakers and clean them so their kids would have some shoes to wear when they headed off to school. It was heartbreaking. And I couldn't walk away from that without doing something to help them and to tell them they are part of the New York family. You don't deserve this just because the federal government doesn't recognize you. I recognize you and you are here. So what you're raising is a larger financial question. So I will have to look at those numbers in the context of the budget and what makes sense. But any way we can be helpful to people, making sure that there's assistance out there, making sure that we got the money for the excluded workers out there. And this was money dedicated to this population, $2.1 billion allocated by the legislature. And the money wasn't going out the door. So this became a very, very immediate priority of mine when I first took office in August. And we did get the money out the door, and there was very great demand for it. And it was just saying, why didn't this happen earlier? What these people, they've had nothing. They've had no income coming in because they lost their jobs as someone who worked at a hotel or a restaurant or cleaning office space because no one's going in the offices, so they don't have a job anymore. They lost their jobs because of no fault of their own, and we had a responsibility to help lift them up and get them through this tough time. Just a lifeline. So I'm going to continue programs like that. We're also making sure that people don't lose their basic utility services. A lot of seniors are affected by this, and we have programs to make sure that it's not shut off. There's emergency programs to keep the water running. It starts in a couple of weeks. So there's many ways we can help people, regardless of their status, to make sure that they don't fall through the cracks.
Now, you raised money. That's a big one in state government. Federal stimulus funding has given the state billions in new funding, but it's not going to last forever. The state, meanwhile, for years has been locked in the structural deficit, largely because of the growth of the state Medicaid program. We've seen the previous administration, including with your own state budget director, who's a holdover from then, use various sleights of hands to kind of balance the books. But all in all, in terms of this growth in state spending, the structural deficit, is this a problem with spending or a problem with revenue?
Well, it's always both. It's a combination of both. And when I was an assembly intern back in college, state budgets were historically done in the summer. They're due at the end of March, but there was always such bickering over it. No one could get their act together, and they never passed them until June, July, or August. And what that did was it paralyzed the local governments and the school districts that could not do their own budgeting. I was one of those local governments. We wanted to get our budget done, but we couldn't do it because we didn't have any certainty from the state. So I'll continue making sure, working with the legislature, that we have an on-time budget, because people should not take that for granted. What happened over the last decade of on-time budgets was not the norm for the decades preceding that. So I'm going to be committed to making sure that happens. But also, yes, we always are going to be looking at our spending. Our revenues are up slightly because we did get assistance. We got the assistance from the federal government. I'm not anticipating this to continue beyond the length of the pandemic, which is winding down. But also, we did have a spike in sales tax revenues. I do again believe that's because people didn't take their trips abroad. They didn't vacation out of state. They didn't spend money elsewhere. They're more conservative because also a lot of people, they didn't spend as much and we out abroad or in other states, but they did spend it here in the state of New York. People traveled within the state of New York. So that was the real shot in the arm that we didn't have or could not have foreseen in the early weeks and months of the pandemic. So we're in a better place. But knowing as well as I do, having done countless municipal budgets, we needed to have a healthier rainy day fund. Our reserves were lower than they should have been. The experts recommend you have about a 15% reserve fund. We were down about 5%. So I used some of our additional revenues to get us up to a healthier 15%, which will also help our bond rating and other issues like that as well. So I'm conscious that the money may be here today. It will not be there tomorrow, and I can't count on that. So that's how we have to approach our budgeting heading into the next year.
Now, your predecessor liked to play the tough guy on holding the line on tax increases. Do you have any red lines in terms of raising taxes on the wealthy?
I'm not interested in driving people out of this state. I believe that we have the right balance right now. I'm not interested in pushing anybody over because those individuals, high net worth individuals, allow us to have the revenue generated as well as their many philanthropic contributions that I need to be able to support the progressive programs I want to have funded. Having them live in Florida and become Florida residents does not help us. So I'm cognizant of that. I also will continue the tax cuts for the middle class that are in place, but I want to have these conversations with the legislature as well on their priorities. But my priority is to continue making sure that people do not view New York State as a high tax and spend state. That reputation did not serve us well during the years I was growing up, as I'm trying to recruit businesses to come here. And we have a lot of office space in the city, but also upstate, a lot of communities, Long Island. Again, I was just there yesterday talking about building up the local economy there with the clean energy initiatives. We have a lot we can do. When I'm attracting people to the state, literally calling CEOs who might be on the hook, I just have to reel them in. They ask me about our tax structure in the state of New York. I'm not going to take any steps that are going to hinder my ability to promote New York State as a great place to bring your business or your existing business to expand. I can continue hiring more people, we can have a more robust recovery, and raising taxes right now will not accomplish that.
And our time together is not going to last forever, Governor. But luckily, you've been pretty efficient answering these questions, and we might just get to the end of my list. I want to pivot back to COVID-19. You certainly have faced a lot of criticism, and a lot of people are supporting you as well over the issue of vaccines and masks in school. We just had some really big news with now younger kids being eligible for the vaccine. A lot of people are really, and New York is actually getting pretty high up there in terms of community immunity, that 80% range. What's the off ramp for requiring masks in schools in your view?
Yeah, I was just talking about this yesterday. I do want to give parents and kids that sense of hope. This is not a permanent situation. The mask will come off. But right now we have 87% of adults in the state of New York have had at least one vaccine. I'm real excited about all the preliminary steps we took to be able to ensure that the availability for the doses for kids will be there, options available in schools. We work with school districts all over the state. They're at the vaccination sites. Pediatricians, we had calls with them. I just spoke to them a couple weeks ago about getting ready for this. I don't have a magic number, and I'll be waiting for the CDC to help us determine when we declare this over. But I also know that a lot of parents in the state appreciate the fact that their little kids are safer because they're wearing masks. And what I'm going to do is encourage parents, if you want your kids to see grandma and grandpa or older aunts and uncles over the Thanksgiving and upcoming holidays, get them vaccinated now so your child does not become the reason that the parent that you fought so hard to protect all these months actually gets sick. Now we can protect our kids, but also that there will be, their universe, the people that they interact with. And again, a lot of times it is older relatives will still be safe. That is why people need to get their kids vaccinated as soon as possible. It's great news that it's available. We're going to be doing everything we can to be creative. I was just playing basketball with little kids where the Brooklyn Nets play at the Barclays Center, and getting them out there on the court, just having some fun and getting them excited about getting their vaccination, let them take their shot. And I'm going to continue finding creative ways to promote this, but I really hope that parents who know that their kids do not show up in kindergarten until they've been vaccinated for a whole host of diseases will do the same. And then we can finally declare the era of masks is over, the pandemic's behind us, and then we just power into the future.
I don't want to harp too much on this one, but I do want to clarify, were you suggesting a bit ago that masks in schools could be required until the official end of the pandemic as declared by, say, the CDC or WHO?
No, I told you I'll be working with the CDC to determine this. And yes, I'm not going to independently just say there's a magic number. If I'm not going to go there. If there's 100% of every child is now vaccinated in the state of New York, it would be illogical to require them to wear masks. So what is the right number? What is the right percentage? It's too early in that. I just want to give people a chance to start thinking about the possibilities and what that's going to look like. I miss seeing little kids' faces. I'm all over the city. I go stop on streets. I talk to parents, their kids are masked. And that's why we have some of the lowest infection rates in the nation, particularly in New York City. And to have them under 2% among all 5 boroughs is quite extraordinary. We can get through this. There will come a time, hopefully sooner than later, where the masks will not be necessary. We're just not there yet. But this vaccine available to kids is so important. It gives us an opportunity to say, yes, we're almost through this. So get the kids vaccinated now so grandma and grandpa are safe this Thanksgiving.
And we'll just do a really quick express question. I think you alluded to some of the various moratoria, the eviction, various utility ones. A lot of them end, I believe, at the end of the year or at some definite date for sure. Do you think you would be willing to extend them in partnership with the legislature?
What we're doing right now is identifying the people who've had to take advantage of these programs, and we are literally at a real micro level working with our Department of Labor to talk to them about job opportunities that are there for them. This assistance was needed because people lost their jobs. They did not have the same income coming in during the pandemic. This is the category of people that have been eligible for the rental assistance. So the question is, do they have a job to go back to? Can they start getting back, heading out there, be able to bring in their income so they can make those rental payments? This was a temporary support program to help lift them up during circumstances that were beyond their control. So let's help them be aware that the job they may have had working at a particular hotel may not be there. How do we transition you to down the street to that restaurant that desperately needs you, or that company that's looking for medical coders who can teach them in a few weeks a skill that's going to be useful? That's what I'm working on right now, is helping people who needed this help before because they did not have their own income, and making sure that they can be independent.
Now I got just two big points. One of them, I swear we're gonna end on a very important Western New York question, but a fun one. But before we get that, criminal justice reforms. I think, you have signed some pretty big bills. I think less is more is the most prominent one, but you just signed like the double bunking one, and I think many others. At the same time, your party really took a shellacking the other day, as President Obama once coined the term. And a lot of it seemed to be because of bail reform. Given the election results, do you think it's time for Democrats, including yourself, to reassess kind of this drive for more criminal justice reforms? Is it time to wait and see? What are your thoughts?
What I can explain to people is that the bills that I signed, and I'm proud of the reforms I signed, do not have a direct correlation to what has been going on in this post-pandemic world, where a lot of people just turned to crime. A lot of people needed more help than they had before. They just kind of fell off the cliff. A lot of people are committing suicide more people engaging in substance abuse, and a lot more overdoses, more domestic violence. Society would seem to be very fragile. And as a result, there has been more crime in the streets. A lot of people just, it's something I think that psychologists and sociologists will be studying for a long time. What happened to people during the pandemic? There has been a spike in crime, but what I'm doing to make sure that we treat people fairly does not have a correlation between the two. Something as simple as less is more. What does that mean to people? What does that mean? It simply means that if you've paid your debt to society, you committed a crime and you went to jail for the length of time you were required to, you are out. But you miss a bail or a parole meeting. You're on the subway, the train is late, you get stuck in traffic, your kids are sick, you miss an appointment, for example. That is known as a technical parole violation. And you could be thrown back in jail for a longer period of time because they don't get to your case than you would have had to serve to punish you for that violation. That's the insanity of what was going on. And it was filling up places like Rikers, which is just a volatile situation. The corrections officers are in danger. The people incarcerated there are in danger. So I was working on that issue separately from my strong desire to make our streets safe again. And that's going to be a multifaceted approach. It's about getting guns off the streets. I'm going to be making announcements on what we're doing on this issue. I just recently signed a law banning ghost guns. So I am hardwired to know that my responsibility as governor is to do everything I can to work with our local governments, whether it's the city of New York, the city of Buffalo, or the city of Watertown, to protect the people in their homes, on the streets, as they head to their businesses. Otherwise, we will not have the full recovery we need. That's what I have to do to bring this back. They are not disconnected from each other. To do one does not necessarily mean you're making something else work. Sometimes it's just common sense reforms that should have been happening, that other states do. New York fell far behind, and that's not related to the spike in crime. But I'm looking forward in the city of New York, for example, working very closely with Eric Adams. We share the same philosophy that we can protect our streets without being abusive. And there's a way to get it done. And we'll show the rest of the country in this post-pandemic world of how we can make our streets safer again, so people have comfort in coming back downtown. And that's how we bring it back.
We're running out of time. I'm gonna get in there really quickly. It sounds like you're saying the election results have not dampened your enthusiasm for a range of criminal justice reforms. Is that fair to say?
I think I signed what I'm going to sign. I also appreciate the opportunity to reaffirm my strong commitment that we will keep protecting the people. We'll continue making sure our police are fully funded, that the issues that people made as campaign wedge issues do not apply to me, because that's never been my philosophy. So I'm not saying I'm doing anything differently because of the election, because this is always who I've been. I've always supported this. I hired a lot of police officers as a local government official. I made sure they had the training and the right temperament. I work very closely with our state police. I understand how important they are. And we need them protecting the communities, particularly communities of color who want that protection. They want to know that when they open the door, that their little grandkids who came over to visit are going to be safe when they go home. I feel these issues deeply, and I'm going to be committed to making sure that all New Yorkers feel safe.
And it looks like we're out of time. One quick question. This was really going through my mind. Couldn't find anyone to answer. Someone from Hamburg, New York. What do you call them? Are they a hamburger, a hamburgerian? What do you say?
I call them my neighbors. We don't. People call us hamburgers. Yeah, that's fine. That's fine.
They're technically German, not the.
Yeah. No, it is from. But we'll get into a larger debate. But I will stand by my belief that the hamburger was invented at the Erie County Fair in the late 1800s by the Mensch brothers. So there's a place in Wisconsin that challenges that. Bring on that debate. They're invented in my hometown.
Well, there you go. The governor's thrown the gauntlet down. Thank you so much, Governor, for joining us today. Lots of ground covered. I really appreciate you taking the time. And I think any politician deserves some credit for answering some tough questions.
All right. Thank you. Look forward to seeing you soon.
Whew, we covered a lot of ground there. Thanks again to the governor for answering them. And
thank you.
Oh, oh, she's taken off now. I didn't see her to the door, unfortunately. So now we're reaching the end of our event. I do want to just let the AARP have one final word with a little video that they have prepared for the occasion. Oh, looks like we might still be struggling there to get the video in. I'll just plug some of our upcoming events in the meantime until it starts playing. Oh, here we go.
And now for the main event of the evening, Real People versus IRX Costs. For years, we've been hit with unaffordable drug prices. But together we've become stronger, and we're going to turn things around. Enough with paying over 3 times what people in other countries pay for the same drugs. Stop drug companies from making money off us through pay to delay. Americans want cheaper generics now. Reverse the course of drug companies raising prices on over 1,000 drugs during the pandemic. Your voice counts. Join us in the fight. Learn more at aarp.org/fair RX prices.
Well, credit where credit is due. As a former motion graphics person, I'd say that was a pretty good animation right there.
Hey, I'm the Dr. Bob Lee from 107.
Let's keep the conversation going, though. Please join us next week as we honor and celebrate the Power of Diversity Women's 100 on Wednesday, November 10th at 5 p.m. Registration is free and can be found on our website and in the chat at the bottom of your screen. And then please join us on Wednesday, November 17th at 5 p.m. as we celebrate the Staten Island Power 100. Registration is free and it can be found on our website, City and State NY, like New York.com, and in the chat. And then on Thursday, November 18th at 1 p.m., our annual virtual government procurement conference. A lot of money, a lot of business being discussed. Registration is free and can be found on our website and in the chat. One last final thanks again to Team Hochul for joining us today. And of course, our great events team at City and State NY. And of course, last but not least, the AARP for helping us put on this wonderful event. I'm Zach Williams, Senior State Politics Reporter at City and State. Catch you next time.